All right, guys, so we are going to be covering the topic of disc today. And so first we'll kind of get into the anatomy of it. We'll talk about reasons why disc injuries may occur, some things that may or may not work. And then what we see here works for people with specific disc injuries in their low back. And so one of the things I wanted to first kind of visualize for you guys is, where is the discs in our back? What role do they play? And so what I'm going to do is have you kind of just zoom in here on our little skeleton friend, okay? And so what you'll see here is we have our low back. This is the pelvis here. This is the head above, so we have our rib cage up and below here. And we have all of our little vertebrae. You have 5 vertebrae in your low back, okay? And in between you have discs here. And they're kind of like almost like shock absorbers. They just play a role in allowing movement in the spine. And so a lot of times what can happen is we like to kind of explain the disc as if it's like a jelly donut. So you have fibers on the outside and you have this little jelly material in the middle. And so when we go through certain motions, that jelly material can be displaced and put in different directions. And so what happens is the jelly material at certain points, either over time or with one big, terrible, like for example, lifting injury, that jelly material can get displaced and it can press on certain fibers of the disc in the low back. And so with the disc here, it's not really innervated or supplied by nerves all throughout the disc. It's just on the outer rims of the disc there. And so when that jelly material hits those nerves there, that's when you start to feel pain. And so I'm going to kind of show that to you on this little dynamic disc model here. If you look, it's the same spot in the low back on the skeleton we were just showing you, but we're going to kind of pull it out and show you here, okay? And so one of the things is, here's the vertebra on top and below, disc here, and then you have your spinal nerves. As we go through things like compression and flexion, you'll start to see, let me make sure that it's actually showing it, you'll start to see that that jelly material starts to press out in the back there, like so. So over time, we go through flexion and compression, and it just starts to migrate more and more and more towards the back there, and it starts to press on nerves in the back of the disc, and that's when we start to feel pain. So things like sitting in rounded postures for long periods of time. I'm going to be sitting here in the chair. I may start upright, and then I'm sitting at work all day long, and I just get tired, and I start to just round like so. And that happens to start to press little jelly material into those nerves and the discs in the low back as well over time. And then we get up and then we go in our car and we sit in that same posture over time. And then we drive from our car to the gym and we go into the gym and we start to do lifting movements and we don't know how to lift properly, or we may just be fatigued over time. So we're going to start to bend and round at the low back here. There's just so many things throughout the day that we cause rounding in our low back, that just over time, that jelly material, we're just not setting it up for success. It's going to continue to migrate back and back and back until it starts to press on spinal nerves. So one of the things that you may start to feel is you could feel sharp shooting pain at first. You could feel things such as muscle spasms. People think that maybe just digging into those muscles is going to really help, but the reason why muscles start to spasm up in that area is because your body is interpreting that as an injury. And that's its own way of trying to protect that area. So it's going to tighten up those muscles and try to prevent more excessive movement in that area. And so that's why our muscles starting to tighten up. And so you're going to feel achiness in your back, soreness over time, sometimes even sharp shooting pain. One of the things we notice specifically with low back disc injury people is they all start to kind of say the common things of what they're experiencing. It's worse in the morning. It's worse first rolling out of bed. Sometimes even sitting on the toilet in the morning, or coughing, sneezing, bearing down. Things of this sort all start to cause that pain to increase. Reason why coughing, sneezing, bearing down causes pain is because what happens is over time, so we call it like a thing called, it's called imbibition. So throughout the day, gravity is kind of pressing down on these discs and we start to lose water in those areas. When we go to bed, that water gets refilled back up in the discs and they start to swell back up again. And so when that swelling happens in that area, those injuries tend to swell up even more as well. So that's why it's worse in the morning. Coughing, sneezing, bearing down, that's increasing pressure in that area as well. I take a big deep breath in and press. I'm increasing intra-abdominal pressure. I'm increasing pressure around the discs there, and then it's causing more swelling and pressure into the areas that we are noticing is causing pain in the first place. So that's kind of some of those things that we start to notice. One of the things people will say, it doesn't necessarily have to be one big lifting injury that caused a big old pop in your back and you're like, oh my gosh, that's my disc. Some of the things that we notice is people are like, I just went to go pick up my keys off of a table and now I threw out my back and I'm screwed. So it's just because this is one of those injuries that can continue to build over time until there's just one specific movement that causes it to really lose its strength and to get pissed off. So that's kind of a little bit about the discs and how it can occur. Some of the things that we notice with people who have disc injuries, they go to the doctor and some of the pain medications will help with the pain, but that's something that they have to continue to take over time. That's because we're not fixing the issue in the first place. It may help with pain, which is great, but we need to go back to the beginning, to the basics, and figure out what it is in the first place that was causing this injury. Are you sitting in rounded postures over time? Are you picking up things properly, using your hips and not your low back? All of these things really play a huge role in fixing the issue in the first place. Sometimes we'll go and we'll get massages, or we'll do some stretching, we'll do things like yoga, and these all seem to be giving this pain in our back temporary relief, but it's not, like I said, going to fix the issue in the first place. So it relieves the muscles, it stretches them out, it causes some decrease in pain for the time being, but you're like, why is it that I wake up the next morning, I'm feeling pain again? And like I said, it's because we're not fixing the issue in the first place. And so one of the things that we like to do here in the office is we go through history and examination and figure out if this is what's causing your pain in the first place. We have tons of examinations that we do here that will kind of cue us in on if this is the issue or not. From there, if we find out we believe that the disc is an issue, then we will continue on down the road of just building strength and building endurance in the area around the spine that's going to continue to protect it. One of the things I wanted to note on first before we continue down that route is people will come in and say, I have a disc injury, my MRI or whatever imaging you got done showed it, and this is what's causing my issues. Sometimes you may have disc injuries. There's people out there who have it and they don't even have any pain at all. And then there's some who don't have positive MRIs for disc issues, and then they do have pain. So really you need to get to somebody who's going to be able to examine you correctly and figure out what really truly is causing your issue and then fix it from there. So how are we going to fix it? One of the things we need to try to do is prevent you, educate you on what was causing it in the first place. Let's find out, were you sitting really in a terrible posture the whole day for long periods of time? We're just going to continue to educate you on certain things to try to stay away from to protect that area going forward. We need to calm the body down in the first place. Second thing we need to do is then now build up the support system. So if we look at our spine here, we have the core that plays a role in the front here. When people think core, they just think the six-pack in the front. So I'm going to do, I need to work on core. Okay, I could do that at home. Okay, well, this isn't just sit-ups that we're going to be doing and working on the six-pack in the front here. If you think about sit-ups, what am I doing with my low back? Say I'm on the ground and I'm doing a sit-up. What am I doing with my low back as I do sit-ups like this? I'm causing more and more rounding in the low back there. When we talk about core here at Performance Place, we're talking not only just the six-pack in the front here. We're talking about the core on the sides of the spine, the core that also plays a role in the back of the spine. The lats play a role in it. The glutes play a role in it. The pelvic floor plays a role in it. Everything around the spine here is like a cylinder, and it plays a role in protecting that area. If all of that is turned on and working properly, you will get no rounding in this low back area in the first place. So when we work on core here, we're going to work on all of those areas, the glutes, the pelvic floor, the six-pack, the obliques, all of that. And so over time, we start to notice the more we work on these things, the more stable we feel in that area, the more we start to use our hips to bend forward, the more strength and endurance we have to just even sit and do our work without having to round because we are starting to feel fatigued. We'll educate you on putting an alarm on your phone every hour or so and just getting up and moving around. Movement's really going to help with blood flow in that area and help promote healing in that area over time. So from here, I want to show you some of the ways that we at home can maybe see if rounding 1 is your issue, and one way that you can try at home to see if this will be fixed, and 2, some of the ways that we can maybe try to incorporate some of these muscles in the area for you at home. So we're going to move out into the weight room and we're going to start to see if I can show you some of these things to try at home. All right, so one of the first things that you're going to be doing at home is you're just going to get down on the floor and you're just going to lay on your stomach like so. Some of you, depending on where you're at in your disc injury, how pissed off it is, or how long this has been going on, we're just going to start off by just kind of relaxing down like so. And I want you to just kind of relax your head into your hands and just breathe into the floor. And so from this position, what I kind of want you to focus on is how we're going to start activating that core in this area. Well, we're going to start to learn how to belly breathe. So instead of breathing into your chest, I want you to think about just pushing your belly button into the floor as you breathe in. You'll see that kind of my low back comes up as I do that. So we're going to hold in this position and belly breathe for just a little bit. If this feels okay here, we're going to start to prop ourselves up like we're reading a book in this position. So you'll notice that this is kind of just the opposite movement that we think was causing your pain in the first place. All of that rounding causing issues in the low back. Maybe just going into the opposite motion is pretty much all you need. So we're just going to hold in a propped up position like this, and same thing, we're going to continue to breathe into the belly and push the belly into the floor. And from here, if this feels really good, we're going to then progress you. If at this point you think this is as far as you can go, that's fine. Sometimes it just takes some time to get used to this position again. If you're feeling okay in this position, we're going to progress forward. And what we'll do is we'll come in our hands. Hands will be kind of close to the elbows here. We're going to relax our glutes and relax our back in this position. And we're just going to push up and down. All we're doing is pretty much just getting in a tricep workout with this. So the only muscle doing work is our arms, pushing ourselves up into this extended position and coming back down. A lot of people, because it's a protective mechanism for their back, they start to squeeze their glutes and squeeze their low back muscles. If that's something that you notice that you're doing, just turn your toes in towards each other and let your heels kind of rock out to the side, and that'll relax those muscles and you can continue to go through this. A little bit of discomfort in that area is normal. As long as the pain isn't traveling down the legs or anywhere of that sort, that's fine. The more you start to go through this, the easier you'll notice that this will get. But like I said, if it travels anywhere, this is not going to be the movement for you. So we're just going to do repetitions of 20 of these or so. And once we get to that point, we're going to retest some of the things that maybe we noticed caused pain in the first place. So if doing a squatting movement caused you pain, do 20 of these and retest that and see if it worked for you. We're looking for a 30% improvement. 30% in just a minute or so of doing 20 press-ups is huge for some people. And then another thing that we want to try to do at home is to see if our core can play a role in protecting this back muscle. So from this position, you're like, oh, getting up from this, I might have some pain actually. Okay, well, one of the things I want you to try is to just stiffen up the belly, okay? The way I try to get people to figure out how to stiffen up the belly is just pretend like you're taking a poop almost, okay? So you're activating that belly area, we're stiffening up right here, and then we're gonna try to get up and out of that position, like so, okay? So just movement, general movement that usually may cause you pain, see if the core is gonna play a huge role in that at all by just stiffening and retesting that movement. It can make huge improvements for some people at home. So if that is working for you, there's a lot of the things that we can build upon here in the office. We're going to take you through strength and conditioning and endurance of those muscles I talked about, the glutes, the core, the lats. We're going to teach you proper hinging movement patterns, things of that sort that's going to set you up for success going forward so that, one, you don't have pain returning as often, and two, this can be something that can last longer periods than just a simple stretch every single day that's going to continue to improve you, but then it comes back again the next day and you're not sure why. So we want to put you into success longer periods of time. We are located in Huntington Beach, California, and just give us a call. We would love to help you out. We have tons of options for people. We're doing virtual visits at this time. We are doing online programs to help you through things like that, teaching you hinging and movement patterns, teaching you core and glute exercises from home, teaching you that prone prop-up position as well. And then our office is open at the time too. So just give us a call. We can brainstorm on what we think would work best for you, and we'd love to help guide you through this.